For untold numbers of people around the world, a bout with COVID-19 is just the beginning. Those in this unlucky group may have thought they'd recovered from the disease. But weeks or months later, they find themselves contending with a baffling array of symptoms that don't quite add up to COVID-19 and just won't go away. It's a condition that has come to be known as long COVID, also known as post-acute sequelae of COVID, or PASC. However, it remains steeped in mystery. Scientists can't say for certain how many people ultimately suffer from the lingering symptoms, why exactly they occur, or whether any particular population is more at risk. But given that more than 33.4 million people nationwide, including almost 3.8 million Californians, have tested positive for the coronavirus at some point during the pandemic, and the true infection count is likely even higher, officials say it's important for people to be aware of the possibility, as well as the warning signs. One study in Italy found that more than half of COVID-19 patients ages 6 to 16 had at least one symptom of long COVID for more than 4 months, with many experiencing symptoms severe enough to impair their daily activities, said Dr. Christina Ghaly, the Los Angeles County Health Services Director. A study from the United Kingdom found that of teenagers infected with the coronavirus, 15% suffered from long COVID symptoms that interfered with their daily lives. Dr. Rochelle Walensky, director of the U.S. Centers for Disease Control and Prevention, said last week that the agency is continuing to work to identify how common these longer-term effects are, who is the most likely to get them, and whether symptoms eventually resolve. Here's a closer look at a condition that threatens to outlast the pandemic. Long COVID is one name for a puzzling syndrome that can afflict people who are infected with the coronavirus. The condition can last for weeks or months, and perhaps longer. Some symptoms are the same as regular COVID-19: fever, fatigue, headaches, coughs, difficulty breathing or shortness of breath, and loss of smell or taste. Others are seemingly unique to long COVID, such as heart palpitations, depression, dizziness upon standing, joint or muscle pain, depression or anxiety, and difficulty concentrating or focusing, a condition sometimes called brain fog. Patients suffering from long COVID say the symptoms can come and go without warning. For some people, they can be severely debilitating, Walensky said during a briefing on Tuesday. The CDC says long COVID can affect people who had only mild cases of COVID-19 and even those who were asymptomatic. However, some experts think there is more convincing evidence that long COVID tends to occur after severe COVID-19 or symptomatic illness. Well-done studies compare people, over the same period, with coronavirus infections with those who did not have infections.